All right. Hello, everyone. You know how they say in pharmacy, in the pharmacy is a small world. I met Jessica when I was a pharmacy student at the ASHP residency showcase in 2016, and I think that was in Las Vegas, right?
Yeah.
And you were my friends. Chrisma was my friend. You were my friend's co-resident.
Yep.
And we met there at ASHP, and we've kept in touch since then. Dr. Johnson graduated from South University School of Pharmacy in 2015 and completed a PGY1, a postgraduate year 1 residency, as well as a PGY2. And she currently works as an ambulatory care practitioner at the VA, Veterans Affairs, providing chronic disease state management for her patients. And one thing we have in common is mentoring and inspiring young people in and guiding them in their whatever their career is. For you is whatever, whether it's a physical therapist or physician assistant or pharmacist, you're able to mentor them in that way. I focus more on pharmacy practitioners, people who want to go into the pharmacy field. I've known you, Dr. Johnson, for so long, and I'm really happy to have you on today. Welcome.
Thank you. Oh, things have been really good. I'm really appreciative of you reaching out to me to be on with you today.
Of course.
Makes me feel good, like I'm somebody. But
of course, hopefully you get to tell us a little bit more about Dream Secured Mentoring, which is your mentoring platform for patient for like I said earlier, for people who want to go into particular careers, and you work with them. Guiding them.
We'll chat about that.
But let's start with pharmacy. And my favorite question, as usual, is what do you like best about being a pharmacist?
What do I like best about being a pharmacist? The main thing I really, really, really enjoy is the part when the patient gets that aha moment when you're explaining either a disease state or a medication in very, very simple terms. So like I talk about diabetes a lot because that's part of, my focus. And so explaining how metformin works or explaining what happens when blood sugar is karate chopping your veins and nerves. And, I really, really enjoy the education aspect of pharmacy because it allows my patients to be empowered and take control of their personal health. And I think that's my favorite part.
And I like how you said karate chop, because one art that pharmacy is explaining in layman's terms to the very complex scientific terms that we use. So karate chop.
I take pride.
I'm gonna start using that. Karate chop with diabetes. Anyway, so you're currently working at the VA. Can you tell us what the VA is and what you do as a pharmacist at the VA?
Sure. So I'm currently in what's called a clinical resource hub. So I actually changed positions here recently, a few months ago. Previously, I was working as an ambulatory care pharmacist within a primary care team at a VA here in Illinois. And a VA is a Veteran Affairs system. So our facility only sees veterans, and we take care of veterans from if they separated early, like they're in their 20s, up until 100 plus years old. Wow. In certain aspects of their healthcare.
Okay. So the VA is the healthcare program for retired and active members of the people who have served in the military, pretty much.
Right. So they're no longer active duty. So they have either separated. We do see some retirees, but most of the retirees may go to what we call a MTF, or medical facilities that's for active duty and retirees. It's layered. So
okay, I see.
Yeah, but a veteran is someone who they may not have retired from the military, so do 20 plus years, but they served in the military for a certain extent of time and then separated or left the military, and they're termed veterans.
Got it. Okay.
Yeah.
So as a pharmacist, what do you do? How do you serve your veterans patients?
Yeah, so in my new role, I'm in the clinical resource hub. So I work for a VISN or region of VAs here in the United States, clearly. But what I do is almost like gap coverage. So my main position as a clinical pharmacy practitioner is I manage chronic disease states. I just prescribe medications, discontinue medications. I have full autonomy in my practice for my patients. I just don't diagnose any disease states, and I don't prescribe any controlled substances. There are clinical pharmacy practitioners who can, as long as they have a DEA license, but I don't. And so patients can refer themselves to me, or the provider can refer them to me to manage anything from diabetes, hypertension, kind of your run-of-the-mill ambulatory care things, to things such as heart failure, COPD, thyroid issues, anything you potentially can walk into your provider with and walk away from. It's not an acute issue. I can manage that.
Okay.
And so,
awesome. Yeah. Okay. So in this scenario, you work under a protocol, under a physician's run protocol, or is it just independently where you can?
Independent. Okay. Yep. So we're mid-level independent providers within the VA system.
Okay. Got it.
Yeah. So
you can prescribe blood pressure, diabetes.
Yep.
Medication.
Anything that's in my scope of practice.
Wow.
I can manage.
Wow. How about lab and monitoring kind of stuff?
Yep. So I can order labs, respond to those labs. If there's anything that's outside of my scope, there's either another pharmacist that it's within their scope, or I connect them with their a specialist or their primary care provider.
Got it.
Yeah.
Got it.
So
yeah. So pretty much as a provider at the VA, you're able to see patients on a regular basis and initiate therapies, monitor those therapies as needed, and follow up with your patients. As long as it takes for their whatever chronic disease they're dealing with is
to reach their goal.
Yeah, it's control, like diabetes, A1C, set
exactly
7 or whatever their goal is. Awesome. Yeah. Awesome. So that's what you do as a pharmacist, but I wanted you to just tell us about why you started Dream Secured Mentoring, what it is, and how people can reach out to you if they need help from you.
Sure, of course. So I started Dream Secured Mentoring because I was mentored as a pharmacy student. I had no idea. I thought I was going to go into retail pharmacy, and one of my professors, I kind of made her be my mentor. And I just really enjoyed the impact that she made into my process, becoming who I am now as a pharmacist. That I've always kind of mentored just naturally. And so I said, okay, let me use the things that I've learned, that where I failed, or where, and make sure that somebody else that's coming behind me doesn't have to fail like I did, or, they may fall, just not as far.
Absolutely.
And of course, as they progress through their professional career or whatever the case may be, I'm still there to support them when they come up against some of the things that I may have already come against.
Absolutely.
Yeah.
And it was the same for me. Like my interest, my inspiration in becoming the rookie pharmacist was just being an immigrant, being a young person moving into the United States and not having anyone to go to. And I had to fail, I had to fall and get back up so many times. And I always say it took me pretty much 16 years from the time I arrived to my pharmacist graduation. But technically, it takes the average American 8 years from, say, high school to becoming a PharmD, but it took me twice as long. So I helped my sister get through pharmacy school, and I found there were so many people coming to me with questions, and I figured there's a lot of people just needing the basic information on how to get through certain things. So I thought, okay, with the Rookie Pharmacist, I could just put myself out there and be available and helping people who need a little bit of guidance to not take 16 years to get through pharmacy school, but at least do it a tiny, if they could do it a tiny bit faster than I did, it would have been worth it to me.
Yeah,
and
definitely.
It's the same kind of inspiration for you. You had to struggle, you had to work hard, and you're putting yourself out there, right? Through mentoring to mentor people and hopefully make their path to the whatever the goal is much smoother. So I really appreciate you coming on and telling us about Dream Secured Mentoring, and also about what you do as a pharmacist at Veterans Affairs, and and hopefully we'll have you on future episodes.
Of course.
On what you do at work. Until then.
Well, let me give my email.
Oh yeah, How do we get in touch with you? How do we get in touch with you?
It's secured, SECURED.dream@gmail.com, or you can find me on Instagram at Dr. Danielle J, 2 L's in Danielle, and Dream Secured Mentoring as well on Instagram.
Perfect. And you can always reach out to me on the Rookie Pharmacist on Instagram, and I'll help you connect with Dr. Johnson if you need to. Thank you so much, everyone. Have a great week. God bless you. I love you. Bye-bye.